Mark. I'm Julie.
Hi.
I'm one of the nurses. I haven't met you yet, but I've come by. The doctors wanted me to come by to draw some labs.
Okay.
I know the nurse was here yesterday, and she drew them and she took the lab, and we got a call from Quest saying that there was a little bit of an issue with the blood draw, and so we need to repeat it. Okay, so I just wanted to let you know that. That's why I'm here today. And I have another nurse who she's new, and she happens to be coming with me today. Her name is Karen.
Hi.
Hello.
How are you?
And she's just going to be watching the procedure of drawing the labs.
Okay.
So,
I haven't been feeling well, so
no.
I've been feeling kind of down. So
Oh, that's too bad. Is that just starch, or are you?
yeah, I guess so. Since they did the when they drew the labs, I've just been
Feeling kind of sad, you mean, or just not feeling well?
just not
like
feeling
kind of,
well, I guess.
Yeah.
So
Okay. Well, when do you have an appointment with your doctor? Are you going to see your doctor anytime soon?
probably in a week or two.
Okay.
So,
So nothing,
somewhere around there.
nothing that, there's no scheduled appointment?
No, not yet.
Okay.
Not unless I really need one after today's thing. So okay.
Okay. And how's your appetite? Are you eating well?
Yeah, I'm okay. Yeah, I just had In and Out, so that was pretty good.
Okay, well that's,
Yeah.
somebody went and got that for you?
Yeah.
Okay.
That's good.
Okay. So what we're going to do is, I know the nurse was here and she changed the dressing on your PICC yesterday, so it's just basically gonna be drawing the labs, okay?
Okay.
Now, I've already washed my hands and sang happy birthday and all that, so it's,
Okay.
so the hand washing's all done.
Uh-huh.
And so I'm just gonna come in and we'll get that
Okay.
taken care of, okay? And how's your wound doing? Is your wound doing any better?
I think it's okay.
I mean the wound on your foot?
Oh, my foot. No, that's fine.
It's
I'm
good.
with that. We stopped letting the dog lick my wound.
Oh, that's-
After that, it healed up just fine.
Good.
So
That's always a good thing.
yeah. So
And as far as that's a good time to talk about infection control.
yeah.
Yes, I understand that you've got I saw your little handout there, that the infectious
Oh, yeah.
control handout that you
Uh-huh.
were referring to, huh?
Yeah.
Good. Two of those.
I think it's
There you
right
go.
over here.
Yes.
So it's all right here. Something about my hands being clean and safe and all that stuff.
Good. Okay, so Cora and I'm going to be,
Okay.
I'm going to get an alcohol wipe and I'm just going to wipe. I'm going to wipe it like about 5 times.
That's a juicy alcohol wipe, right?
Mm-hmm. Yes, it is. And I'm going to let it dry.
That could take a while with that dry.
Mm-hmm.
I
They don't want you
guess.
to blow on it, okay? So no helping it
Oh,
out.
I don't know.
Okay, now I'm going to take a 10 ml syringe and hook it onto the end of the cap, and I'm just going to draw back 5 milliliters. So let's do that. And I'm just going to disconnect,
I think I'm dried up.
and I'm going to put that in the sharps container. Connect you. I'm going to draw back the labs that I need.
Must be running on empty there.
Yeah, I
huh?
know. You have clear blood.
I guess so.
And I'm gonna just- and then I'm going to get the little Christmas tree,
Yeah.
Oh, okay.
put it together. Take off the cap and connect that onto the lab tube. And if there's actually blood in that, that would actually vacuum into the tube. Okay, once I have that full, I'm going to throw that into the sharps as well. What I'm going to do now, Mark, is I'm going to just wipe the cap
Oh, okay.
again, and I'm just going to give it a flush.
Okay.
Try a little bit. This way I'm just going to get, there's a little bit of blood in the tubing, and we're just going
Okay.
to give it a flush with some saline. Give it a push pause. And then this other syringe I have that has saline in it, I've got the air out of it, so I'm going to put it on the end of the cap, and I'm going to just prime it a little bit to get the air out of the little bit of air that will be in the cap. I'm going to take off the cap.
Just in case I haven't been any dust there.
I'm going to take the cap off. Use a new wipe. Like this. Again for 5 good wipes. And let it dry.
It's kind of important to let it dry here. We just had somebody complain that the cap didn't come off, and they were wondering why, and we're deciding that when it's wet and you attach it, it seals it in and locks it like glue, so the next nurse can't get the thing off.
Well, they can't get it off then?
Yeah.
Okay, I'm just going to...
Oh, well, that wouldn't be good.
No.
No. Okay, and then I'm going to flush it with one more saline.
It's a lot of flushing.
It is a lot of saline, huh?
The bird's eye view of a lab draw can be broken down into a specific process, which a surveyor would definitely hone in on. Here's a view of how the specific process might look.
All right, our focus for this piece is just to demonstrate a correct central line lab draw. Make sure we cover all the right points to make on that. First thing you need for any lab draw, obviously, is an order. So check and make sure you have the order. And the second thing you might need would be the gear. So for lab draw gear, don't forget the sharps container. If you don't have a patient that's an infusion patient, you will have to bring in your own sharps container from your car. We don't want staff to take syringes full of blood to their cars and drop them in the back seat. Laying around there would not be a good idea. And so make sure you have your sharps container. Your other piece of gear would be your biohazard lunchbox. Your biohazard bag, so that your labs can be toted correctly with in your plastic container, so that in case there's an accident, your stuff and their blood doesn't get all mixed up together. So that's kind of part of the gear to bring in. The other part of the gear is obviously the lab tubes that you will need and the flushes that are sufficient for what you need to draw. In this case, we will draw a tiger top and a PTINR. We'll need, for flushes, if you have TPN, you'll need 2 additional for a total of 20 mLs of flush per port. If you have TPN, you must first stop the TPN, disconnect the TPN, and then flush each port with 20 mLs of saline. So you could end up with a lot of flushes if you had TPN actually running when you arrived at the patient home. Other than TPN, just a regular lab draw, you would need 1 syringe for your discard. You would need 2 saline syringes for your follow-up flush. And if your line was not valved, you would also need your additional heparin. And you would also, of course, need your syringe for the actual lab draw. So what I like to do before I get started is set up my cap change. Every lab draw requires a cap change afterwards. So I go ahead and take my second saline flush and go ahead and attach my cap ahead of time, have it all flushed, ready to go.
Now, would you have washed your
the
hands
cap.
before that time?
Oh, I did when I
Okay,
started,
sorry.
yeah.
I was setting up stuff over here.
Yeah. So we started with clean hands, and we just flush that cap and get it ready. So when it comes time for the cap change, we'll be ready to go. All right?
Do I have a valve or a non-valved PICC line?
Ah, that's the question. So remember what you asked. The first thing you look for is it clamped or unclamped? And it is not clamped, so we know it's a valved catheter. And then you read the line to determine it is a PICC Solo. So that's how you can tell exactly what kind of line you're dealing with. Clamps or not clamps, and then read it. So that identifies your line, and so in this case, heparin would not be needed. If you find heparin in the home, and you've identified it's a valve catheter, what are you supposed to do with that heparin? That's right, take it out, bring it to pharmacy. If you leave it in the house, somebody's going to be using it, so we don't want them to use it. Also, alert pharmacy that that line is a valve line, and they don't need to be sending heparin out on this patient anymore. Okay, so I always like to redo hand hygiene right before I put on the gloves, just in case touching the environment happened and contracted something from the table or something.
So we know each other, but if you were doing this for the first time, how would you identify me if you didn't know me?
Well, and what is your name?
Sharon Fredericks.
Alrighty, and then tell me your birthday that would match what is
No,
on-
not on film.
that would match
Here,
on-
down here, I'll print it on my leg for you.
There you go. So those are the two patient identifiers.
Okay,
Now, if I ask if their name is Sharon, that would not be good because,
I might be confused.
and she would love to be Sharon for the day, and that would send us on a wrong path. So.
It could.
Yeah. Okay, so we're getting ready to draw labs. So I want to identify this port. It's the red one for lab draws. I want to take a Juicy alcohol prep pad and cleanse that line at least 5 times. Make sure it dries completely because the quote from Kurt is, Kurt's sheet on how to mix meds is, the antiseptic qualities of alcohol only occur upon drying. I'll never forget that one. All right, so we have our 5 mLs of waste. So we're drawing back. There is blood in here. Clear blood, but blood nonetheless. And that 5 mLs of blood goes directly into your biohazard container. You don't want it laying around for the dog to get or to flush into the toilet or any of that. Just go straight in the biohazard, done. Then you have your syringe for drawing blood.
You know us vegetarians have different colored blood, don't you?
That's right.
That's why
Clear.
you can't see.
Doesn't eat red meat. Perfectly clear blood. Alrighty. What I like to do is getting ready for the changeover. I like to have my saline ready.
Now what happens if I have Parkinson's and I start shaking here? It stays on pretty good, doesn't it? Okay.
So I'm going to put my Christmas tree in the one hand, get my saline ready, my saline flush, and have this ready to go for my first draw. Actually this one, because it's quantity determined. And I'm going to take my sample, place it here. Get my flush started. I don't have to worry about that anymore, and I can focus on putting my blood in the tubes. My line's already started to be flushed. When you're getting the labs ready, it's Quest prefers 8 turns on these most lab tubes to fully mix it. And this sharps goes straight into the sharps container. 8 times mixed, and then I can finish this flush, which I'm going to pretend because I don't want to get her all wet today. And then once that flush is finished, I can work on changing the cap. Cleanse the area here, the joint as it were, in case there's dust on there.
So how long does that usually take to dry?
Yeah, it seems to be taking longer and longer.
Can I go like this?
Probably not a good idea.
Why?
You want,
I'm only helpful.
right. Apparently what they say is the air contains all kinds of things, so if you wave the air, those things could end up waving onto the moistened area, so they're frowning upon the flapping of the waving.
So what if I coughed on that right now?
That would be the worst thing.
Oh,
So if you do need to cough, you can turn your head.
okay.
And when you're doing PICC line dressings, nurses know to instruct the patient to look the other direction, which is not always effective. So if you have a patient that won't do what they're supposed to, you can actually put a mask on them. It's like put a bird on it. You just put a mask on it and then you're good. All right, so we are definitely dry now.
No, we're dry.
Yeah, we're dry. So I will get this ready. Take this off. Occasionally, it's helpful or necessary to clean this area. This looks perfectly clean. I'm not going to extra clean it. In the case of it being a little bit crusted over or something, it's okay to take a alcohol prep pad and clean that area first. This needs to completely dry before you put the new cap on, or else the moisture locks into the cap and then you end up with a cap that won't come off for the next clinician. That's just learned that last week. So perfectly dry, and then you're ready for your second flush, which you pause all the way down, and then your very last ml you unplug while you're flushing, and it should get just a little wet, which means you put positive pressure in that cap, which will keep it from clotting, keep blood cells from collecting on the tip. So preventative push pause and positive pressure flush at the end. I think that's it.
So would you label these, if you were in the home, would you label these in front of me?
Yes,
Okay.
mandatory.
Okay.
With patient name, date of birth, date, time, and my initials.
Okay.
5 items to label.
Okay.
With a Sharpie pen,
Oh,
because
the
a regular
Sharpie
pen
pen.
doesn't work.
Okay.
Want to make sure when after labeling the lab tubes correctly, you want to place them in that hazard-proof thick plastic container. And when you get to Quest Lab, they are going to wish that you are using their lab bags. There's a split in the lab bag. One section is for the paperwork, one section is for the tubes. They don't want the two mixed together. And they want the lab slip folded so that the code bar is on the outside, so they don't have to open this to scan that sample in. So these are some requests from Quest Lab to make their job easier and less hands-on for them touching these lab samples. Then when you are ready to pack it up, you would go ahead and pack it up and close your sharps box, and you would travel then with your lab sample box behind the driver's seat, so in case of an accident you're not being contaminated with what's in there. So never put this next to you on the seat, on the driver's seat. Joint Commission, state, they all want it behind.
In the back seat.
In the
on
back
floor.
seat, yeah. Okay?
All right. Thank you, Kim.
All right, so when drawing multiple labs, there's another device. It's called the BB Container Lure Lock Access Device for multiple lab draws. So when we're drawing labs using, say for TPN or a drug lab level where we need to draw multiple tubes, sometimes it's quicker and in the best interest of the nurse to use this device to get your lab samples. So you collect the sample the same way you did before. Clean the cap for the designated period of time with the juicing it well. Do this one. So you do the same cleaning technique here and letting it dry. And then once it's dry, you simply attach this end to the end of the cap, and you are now free to draw your labs. This does require a free-flowing line, so if your line is a bit sluggish, this won't work. You will then need to use the syringe and Christmas tree method of drawing multiple labs, but if that's not an issue, you can just fill one lab at a time and simply fill up that way. When you're finished, you would unhook this and then begin your flush procedure. Your first flush with your saline will clear the line. So as you complete your flush, your first flush, you would simply finish your first flush. You would unhook your syringe, and then your second flush would be ready to go with your primed cap. And you'd be ready then to change the cap as demonstrated earlier. Cleaning around the end. Letting it dry. Trying to unhook it. This is what we said before, if you can if you get it wet and it's not, if it's wet when it goes on, that's a problem you have. So you want to be careful to make sure it's dry. If you clean in between, otherwise you have that problem where it locks in like cement and then the next nurse has a hard time getting that off. So that was exactly what we wanted to avoid the last time. Make sure this dries completely before you put the new cap on.
Can't believe that in the last nurse.
She has strong arms. No, it's that taping it. All right, and so then you can flush your second flush. And make sure you unhook the last flush so that it drips saline, and then you're set to go.
Okay. And I was gonna look in your fridge and see how you, just take a look at how many antibiotics you have left and go check
Oh,
that out
okay.
if you're okay with that.
Maybe I can get
And
my
I'm gonna go
brother
over here.
to show you where the fridge is,
Okay. Your brother's here?
somewhere.
Yes.
I don't know what my brother's name is.
Okay, those all check out pretty good. Hi,
Hi.
I'm Julie.
I'm Gabriel.
Hi Gabriel, nice to meet you.
Nice to meet you. How's old Mark holding up?
He's holding up pretty good. He's
Old Mark.
He carries enough gray for both of us.
I see. You get along well, do you?
Yeah.
Oh, yeah.
That's
A
good.
lot of years.
So what, a lot of years, you go back being
We
brothers
go
a lot
back
of
a
years?
lot.
I see, yes, that's usually the way it is with
Yeah.
brothers.
Yes.
We
So-
shared a room for a long time.
I see.
Yeah.
Okay. And I see a whole bunch of new medication over here.
Yes, yes.
We have a smorgasbord of medications.
Smorgasbord of medications, and I'll have to look, maybe it would be a good idea right now if I go on my computer and we can go through all that to see what's
Okay.
new, and we'll just go over your medications,
good.
okay?
Okay.
That'll work? Great. Think it'll work. I was just gonna show you, Karen, how to pull up on the computer where to
Okay.
document the labs.
Okay.
You go into the problems, and here's the order here that we have to draw today. It's a CBC and a CMP,
Oh, okay.
okay? And
You better take
so you always want to make sure that you've got the order, and then you can, then after that, you just would document in the problems that you did indeed draw them, and then document in the clinical note that what you did and drew it from the PICC line and so forth, and that the labs went to Quest, and
Okay.
in the clinical note, okay? Okay, Mark, your nurse is going to be back next week
Mhm.
to change the dressing on your PICC line and to change the dressing on your foot. So the labs are going to go to Quest, and if you have any questions, call. If you have any concerns, give us a call. You know how to get a hold of us, right?
Yeah.
Okay,
I think I have your number.
good. You have it in the folder?
Yeah.
Good.
Somewhere around
He likes to call often, not a problem.
there. I like to call. I'm
You know the
lonely.
number by heart, huh?
Lonely, I like to just call and talk to people, so.
Okay. Okay.
All right.
Well, it was nice to meet you.
It's nice to
and-
meet you.
And take care.
All right, thank you.
Okay.
Thank you.
Thank you, brother.
Thank you.